Welcome to the podcast recording of Middle East AI News, live for Thursday, August 22nd, 2024, brought to you by On Demand, turbocharged AI product development and integration. You're listening to my discussion with Dr. Siddiq Anwar, consultant physician and nephrologist at Sheikh Shakhbout Medical City. We're talking about the hospital's new RenAIssance AI Lab, global healthcare challenges, and how AI is shaping the future of healthcare.
Well, let's dive into today's topic. In today's Thursday Deep Dive, we're going to be talking about the future of healthcare, some of today's most significant medical challenges, AI's impact on global healthcare, and the new RenAIssance AI Lab at Sheikh Shakhbout Medical City, or SSMC. In today's show, we'll touch on SSMC and the role it plays in the UAE's healthcare ecosystem, why SSMC established the RenAIssance AI Lab, some of today's biggest healthcare challenges, how AI impacts the future of healthcare, and what can we expect from the new AI Healthcare Lab at SSMC. And I'm going to be joined in a moment by Dr. Siddiq Anwar, consultant physician and nephrologist at SSMC. Dr. Anwar is a consultant general medicine physician and nephrologist at SSMC in Abu Dhabi. He completed his nephrology fellowship and renal transplant fellowship from Washington University School of Medicine in St. Louis, USA, and received a certification of completion of training in nephrology and general internal medicine from the UK. With more than 20 years' experience, Dr. Anwar provides diagnosis and treatment for a variety of kidney-related conditions. He's a special interest in health informatics, health systems engineering, simulation training, and the use of AI in healthcare. And among many committees and working groups he serves on, Dr. Anwar is a member of Malafi Clinical Advisory Council, a visiting fellow at ADIA Lab, and a member of the Middle East Region Board for International Society of Nephrology, ISN. And he's also the project lead for the new RenAIssance AI Lab at SSMC. So a warm welcome to Middle East AI News Live, Dr. Anwar.
Good afternoon, everyone. Thank you very much for this opportunity, and I look forward to speaking to your audience.
Thanks so much for joining us and coming on to talk about the RenAIssance AI Lab. I suggest to start off with, we just talk a little bit about SSMC itself, and then how the idea for this new AI lab came about.
So SSMC is one of the largest tertiary care hospitals in the UAE, and it's part of the Pure Health Network. It was established in 2019. I joined 2021 from SEHA, which is a sister network. It's the National Center for Trauma and Burns, and it also has a large cancer service and a 26-bed neonatal intensive care. So we have a state-of-the-art facility. We're also one of the biggest academic institutions, training a lot of next generation of Emirati healthcare leaders. And for myself, I've been in UAE for the last 6 years. I was hired at that time in SEHA to set up a transplant program. And I was fortunate to train in UK, London, UK, and in St. Louis. And before coming to UAE, I was to work in King Faisal Specialist Hospital as a consultant nephrologist.
What actually inspired SSMC to create this new AI lab?
So the story starts 6 years ago. I'm actually a full-time physician, and I'm actually just a clinician. So what happened was I was brought to set up a transplant program. And to set up a transplant program, I worked in mature healthcare systems in the West. There's already a funnel created where patients are brought to your clinic. And even though we have a huge population of dialysis, unfortunately, kidney disease is rife, not just in this region, across the global south, because of rising lifestyle diseases like diabetes and hypertension. People who are on dialysis were not being recognized on our electronic medical record. So the problem I was initially trying to solve was just to bring more patients to my clinic. And in that process, we started a digitalization program of bringing end-stage renal care into the digitalization of end-stage renal disease program. There used to be a group CEO called Gareth Goodyear at the time of SEHA. He supported this initiative. And when I started understanding what a digital-first healthcare could do in streamlining practices, reducing waste, develop better QA to ensure better patient experience, better patient quality, patient healthcare quality, I started learning more. In this process, I got to meet and make friendship with a lot of people from the health informatics department, from our SEHA services, and that expanded my own understanding about what a digital-first enabled healthcare could do. And when I started meeting these folks and they understood that I'm trying to create a structured data set, they said that they introduced me to machine learning, artificial intelligence, And that brought me in touch with my two main collaborators. One is Dr. Mesut Emre. He's from Khalifa University. He's a health systems engineer and studies the interaction of humans and computers. And Mohammed Yaqub from Mohammed bin Zayed University of Artificial Intelligence. He is a computer vision AI scientist. Before he came to UAE, he built the fetal anomaly scan AI software which was bought by GE in the end. And this, as the people say, that innovation only occurs when people from two different streams start working together. So I'm very fortunate that UAE provides that ecosystem where you have a lot of brilliant people around. And when you start explaining to people the problem you're trying to solve, and when you meet people from outside your own domain, they can give you a different perspective how this problem can be solved. So that is the genesis of how this team came together. Regarding the problem statement itself, which we tried to solve, it is not novel. When Google entered the healthcare space for the first time through its DeepMind AI group, the first problem they were trying to solve was acute kidney injury. And there's actually a paper in Nature. And if you even Google DeepMind AI, AKI, acute kidney injury, you'll find that. So what they did was, in the UK, they got access to the healthcare data. Acute kidney injury is a very common problem in hospital. 1/5 of all hospitalized patients get acute kidney injury. It increases length of stay, it adds to hospital costs, and increases mortality. This came up in a NCPOD report, which is put out by NHS every year, of the most common cause of death in the hospital. And then the government mandated that every hospital reports its in-hospital acute kidney injury rates publicly. It's publicly available, and it's available on the UK Renal Registry. It became a patient safety thermometer. And for the non-medics in the audience, acute kidney injury is measured just by a rise in creatinine, which is a biomarker we use. So it's just rise in a number, which a machine can detect faster, more accurately than a human being, of course. So that's what that paper was about. But unfortunately, because of some data issues, Google got in trouble and they dropped that project and they moved on to other things. But that was a seed of our idea. Like, if I could tackle acute kidney injury holistically, and inpatient acute kidney injuries largely because of too much fluid, too little fluid in the body, or kidneys getting blocked. And this we could do in a mathematical, protocolized way. And if we do that, this could be learned by a machine, which will allow us to scale and diffuse best practices. So that's the kind of genesis of the idea. How can we digitalize best practices which exist in our ecosystem, which allows a machine to learn that the same way humans learn that? So I was fortunate to train in St. Louis, it's the biggest nephrology program in the world. I was also training Richard Bright. These institutions have an institutional memory, which is passed down by word. I work for a big professor. He teaches me some best practices, and then that's passed down to the next generation. And that's why these centers are leading centers, in my case, nephrology, but I'm sure there are other centers across the world for other specialties. But in countries like us or India, where I come from, well, these institutions don't exist, and not enough professors exist who can share their best practice. But the beauty of this new era we are living in is, if we can teach machines best practices, we can diffuse these best practices in a digitalized system, healthcare system. And that is the kind of the next big idea we're working on, is if we can create a healthcare platform which learns best practices, assesses best practices, then you can deploy AI solutions which will allow you to do most of the cut work, which consumes a lot of resources, a lot of bandwidth, a lot of money. And we can talk more about what we're doing, but this is the kind of big idea. And this is, again, not novel. And if you just Google Mayo Clinic platform, Mayo Clinic is doing the same. So what they're doing is they're learning the best practices in their sites, and they have a one unified electronic medical record. And once they understood the best practices, they're diffusing across their network. Not only that, they're allowing other startups to come and with the APIs or deploy their solutions, which will again allow them to diffuse those best practices. That's going to be the future of healthcare, I believe. Digital first healthcare, tech enabled healthcare, digitalizing your best practices so that you create institutional memory. Not only that, the next evolution of that would be once you establish that, you will unlock value in your data, which will allow you to monetize or do research, join international consortia. Those kind of things are possible.
So this was a project that was 5 or 6 years in the making then?
Yes, 6 years in making, largely because you see, if you think about AI in healthcare, it's still a gimmicky idea for now because it is not unlocked growth and value for these individual organizations. And largely, we've been having to create these small success stories which led to this big thing happening. And the first thing which we did was set a point of care ultrasound academy, where once we understood that in-hospital acute kidney injury is because of too much fluid, too little fluid, or kidneys being blocked, we set up a program to train non-experts to do things which I do. And for that, we partnered with a ultrasound company which has an AI solution built in it called US2AI, and the company is Econos. I'm not plugging the company, but this is what the future of healthcare would look like. That if non-experts acquires ultrasound images which are curated and QA'd by this AI algorithm, the AI algorithm will then measure the cardiac output, fluid status. That will allow this non-expert to do the initial management and doesn't have to wait for a nephrologist to come. And it's a big problem because many countries don't have highly trained physicians. Then we submitted a research grant to the Department of Health, who kindly awarded a grant for $500,000, which allowed us to set up this lab.
Let's talk a little bit about the global healthcare challenges that AI and perhaps the new RenAIssance lab will help to address. From your perspective, what are some of the most pressing global healthcare challenges?
Access to healthcare is still, high quality healthcare is still a problem in Global South. And just talking from my own specialty to give it and to illustrate this with examples, 10% of the world's population has kidney disease. Most of them live in the Global South. So the current healthcare delivery model for kidney care is very much people-driven, people delivered, and legacy system. And just to give you some numbers for the audience to mull over, America spends 1% of its federal budget on dialysis. That's $80 billion for dialysis, and around $250 billion on management of renal care. And this is for a population of 1 million. This model of care cannot be delivered by countries who have most of the people with kidney disease. I am from India originally. India has recently launched a free dialysis program for people below poverty line. Unfortunately, 250,000 people end up on dialysis every year. 250,000. So as far as the public statistics go, there are 2,000 licensed nephrologists in India. So 2,000 people cannot look after millions of people on dialysis. And there's no way, unless we create AI algorithms which will allow you to do the QA of the dialysis program, to help us identify patients who are more at risk of getting hospitalized or dying or developing infection, identify patients who could be transplanted so we can get them off dialysis program. And actually, there's a lot of work being done already by there's an institute called Renal Research Institute in New York, and they have been working with the Apollo database of Fresenius Medical Care, and they've developed many AI solutions. But the biggest problem most of these countries in the Global South have is the digital maturity of the healthcare system. So we are very fortunate in UAE, the leadership of the country has invested so much on the digital maturity. You have Malafi, all hospital systems have to integrate to Malafi through the electronic medical record. And of course, the government is pushing heavily on AI. But most of these countries, still healthcare is paper-based, legacy processes, and there's no institutional memory. And so what I feel will happen is that countries like India, which I was mentioning, they will soon be in a situation, they have a huge problem to solve right now. And people like me who take 15 years to train are not available to bridge the gap. And this will allow new models of care to develop, which will be digital first and tech enabled, where AI will play a big role. And I think so. What UAE provides is a great sandbox for co-development of these AI solutions. Like I'm working in nephrology, of course, but I have colleagues of mine who are working with Mohammed Yaqub for cardiology-related solutions. I have colleagues working, Mohammed Yaqub, I know, is working with my colleagues in Cornish Hospital, which is a maternity and children's hospital, to develop some tools around cardiac anomalies in fetuses. So this, I suspect, there will be some leaders like UAE, which have the digital maturity, who have the vision at the top, who are investing heavily in AI, will develop these tools, which allow maybe startups to come here, who will co-develop tools with physicians, which can then be deployed in the global south, who have a pressing need right now.
Do you have a feeling for how long it will take before those things have an impact in other regions like India or Africa or global south?
So yes, this is, of course, you need a vision, no doubt at the top that you need a healthcare vision for the country. Unfortunately, most of these countries which we're talking about, the pressing need of unemployment, social disparities, day-to-day life is the most pressing concern. But what is interesting though is these countries skip the PC generation. For example, the first device I bought was a PC. But most of these population moved directly to mobiles. And like for example, in India, there was this demonetization which took place in mid-2010s and the implementation of GST, which allowed even a small village person to have a mobile phone. Some statistics like 800 million people in India have mobile phones. So there's already a healthcare stack being developed by the same people who developed the Unified Payment Gateway. If healthcare data can exchange across mobile phones, that will allow deployment of AI solutions, which will guide these people that you are at risk of developing kidney disease because you have diabetes, you have uncontrolled blood pressure, you're obese, you're not walking as many steps. And that way the government can incentivize wellness versus dialysis. Right now in India, they're paying for dialysis, which is not possible, I believe, for the population we're facing. But if they could identify who's at risk of developing kidney disease, and I'm sure there are developers who can develop those solutions here, they can then integrate to this ABHA. It's called ABHA, AB sandbox. They have a sandbox as well. So ABHA, it's a unified healthcare stack they've developed in India, which is not completely operationalized yet. But if they could integrate, I feel it will get decentralized because they don't have these legacy systems where these big tertiary care hospital, university hospital exists. They will have to innovate to provide healthcare. Now, for example, in India, what happened was my age group, which is in the 40s, suddenly become affluent. And now we are going to reach that age where we develop lifestyle diseases. And I actually want to live till 70 to 80 so I can enjoy my livelihood and then my children's lives. So I will want to look after my health. So some of the audience will grow it, and who is my part of the world, that when I used to be young, they should say, oh, someone died. When I used to ask why they died, they say, oh, he became old. And it was 60 years old. But now people are living to 70 or 80, and they want to live to 70 or 80. They want to live well till 70 to 80. That will be the driver of change because the consumer will ask for this. And if you think about every other industry, thanks to Google, Meta, and everyone, they disrupted these segments so much the consumer had the choice and the power to choose its provider. In healthcare industry, unfortunately, the power still rests with the doctor and the hospital. You have to access me to get information on how to look after kidney health. Even though this information I don't generate on my own, I do look at guidelines. I do look at what the American Society of Nephrology says, what KDIGO says, and then I distill that information to tell you that. But if you think about other industries, that got completely disrupted. Now, I used to go to Thomas Cook to book a flight, but I booked my flight through Google now. So that disruption is going to happen out of necessity in Global South. Here, it will still be time, but there, It is because life and death. And that's what's going to drive this change. And that will, of course, mean that you will be actually develop new models of care, will be cheaper, sustainable, and where the power in that relationship will move to the customer, the patient, and he will choose that. I'm trying to engage with the regulators in India and trying to say to them is that your job is not to provide free care, but to invest the little money you have to create that unified healthcare stack. And they have a success story in UPI, a world famous success story, that they could allow startups to come in who can provide world-class care to people before they fall really ill. Those are my thoughts.
And where do you see AI adding value to this digitized healthcare service?
Of course, I'm an end-stage renal disease doctor, and there are great tools already being developed. Like, for example, recently I was evaluating a tool by a famous professor from Paris called Alexander Lupi, who actually built a spin-off to a company called Predict for Health. It's usually previously called iBox. So those kind of solutions, bespoke solutions will come, which will help solve complex problems in the hospital, or say for pharma to the new drug development and all that. But I think the biggest boon this will provide is for life care and care. Because as most of the money right now is consumed by sick care, which is where I work, when people fall ill and they come to see us and we spend like billions of money. But if we could digitize healthcare, empower the user, made it digital first, maybe mobile first, these AI tools can help these people make better healthcare decisions. And actually, if you think about the way I shop, the way I can buy tickets, already there are AI solutions, even without me knowing, making those choices for me. Amazon knows what I'm going to buy next as soon as I open their website. And same for Google Flights and hotels and Instagram, the way they give me ads. They presumably understand my behavior, shopping behavior, travel behavior, to give me those suggestions. So those same learnings could be deployed, keep people healthy so they don't fall ill, end up on dialysis or develop kidney failure. And I think that's going to be the biggest revolution. I'm hoping it happens soon because as I mentioned, the need is right now. And I was actually evaluating a solution called ClinRisk, developed by a nephrology professor, colleague of mine, Navdeep Tangri. And this will allow you to predict who will develop end-stage renal disease. Because most monies which are consumed is to manage people on dialysis. But actually, if you could redirect the money to find people who are at risk of developing renal failure, give them the GLP agonists, give them the SGLT2 inhibitors, the statin, aspirin upfront, which is much more cheaper, you will reduce people who end up on dialysis long term. This solution is already available, but needs to be deployed. We are fortunate we have Malafi, but this could be deployed on your mobile phone, I believe, if you have digitized your own personal health record.
So you would see this being scaled in the global south and in developing countries via mobile devices? Because I've seen a lot of big global healthcare systems that have been working very hard on patient-centric healthcare, preventative healthcare, but a lot of healthcare institutions don't have the money to invest in this kind of technology.
Yes, I think so. If you think about the impact of AI in healthcare in the Western system, they have a huge legacy debt. That's one. Second thing is the incentives are not aligned because we get paid on dialysis. We get paid nicely on dialysis. So why should I focus my energy on prevention? Because prevention means it takes 5 to 10 years to see an impact. And if you're living quarter to quarter, answering to your shareholders, you'll of course focus on immediate revenue streams versus long-term care. And of course, sick care is profitable. Mayo Clinic is insanely profitable as an entity. We know that, even though it's a non-profit, by the way, because when you're sick, you end up getting CT scans, you get lots of medications, lots of tests, you get to see me, and that is all costs. So the incentives are not aligned in the West right now. And as revenue cycle management itself is an industry, Optum, you know about that, because it's a system which is set, huge players, disruption is difficult. But countries which have no legacy system, no legacy debt, and these are voters. And there was a state elections in India recently. There's a company called Novo Medical. It's a big point of care testing machine. He's actually led by a nephrologist, thankfully. So he sponsored a program for a fellow nephrologist, I know, where he started screening for kidney disease through a point-of-care device, which is the size of your mobile phone. And these people who were screening were, we call them Anghami workers. Like these are kind of government workers who do education, provide free meals, do many government schemes. They're doing this pinprick test to check if they have kidney disease. And they found there's a huge population in this part of the world, Andhra, who have kidney disease. And now the government is focusing on them because these are people, unlike in the West, people who develop kidney disease are age 40 in our part of the world. And these are your voters, these are your main breadwinners. And of course, these are the part of society which is the main contributor to society. So I think so even the politicians will want to look after these people. And because huge communities are being affected, the government is going to incentivize screening, I believe, and that's going to happen. And that will allow these disruptive startups to come in.
Let's zoom into the new AI lab in a bit more detail. What are going to be the key focus areas for the RenAIssance lab?
So we have a bunch of projects already on the way around acute kidney injury, because that's what I'm focused on right now. We have research going on use of point-of-care ultrasound with a computer vision AI tool to see if this will allow us to train the non-experts to acquire reasonable views, because ultrasound is a very much user-dependent modality. It takes a lot of time to learn how to acquire images. And traditionally in healthcare, your duration of your training is your badge of honor. So if you look at my own CV, I will detail all the places I trained. I went to Paris, I went to Sao Paulo, I went to Lisbon, I went to St. Louis, of course, training many places in the UK. That is my badge of honor. But if you think about what AI can do, it could democratize knowledge, democratize acquiring knowledge, and democratize even maintaining knowledge. So this is what I feel the new paradigm will be. So for us to learn to acquire ultrasound, it took me a long time. But this computer vision tool, called built by US2 AI, will allow you to acquire enough images to assess if the patient is wet, dry, or obstructed. And that's all we need to know in hospital acute kidney injury. And this could be done by a paramedic in the field of war. It could be done by a midwife in Africa. It's already happening. Melinda Gates Foundation is funding a program through a AI-driven company called Butterfly. Some of you may know that. In Africa, they are giving these devices to midwives in Africa. And so they are doing the assessments there now. And so that we want to validate that. We've already done a couple of publications. We got more on the way. Essentially, we're trying to create a new learning model in this age of AI, where it's not the length of training which matters. It is, can you work with these AI-enabled solutions to deliver high-quality point of care? Because they will never replace, in my mind, high-end work. Definitely, we will not go into the realm of diagnostics, which is a completely different way. But point of care is yes or no. Is the patient fluid overloaded or no? Is the kidney obstructed or no? Yes or no answers, which is most of our decision making, can be done by computer much more reliably. That's what my area of focus is. Can we make those yes or no answers done by machines faster? They're not in the machine, by AI-enabled solution, which means a non-expert can make secure, reliable decisions. Of course, the diagnostic aspect also people are working on. I'm not touching that aspect. The yes or no answer is just like most of the decision making in the hospitals can be done by AI-enabled solution.
And this research is being done in collaboration with other institutions in Abu Dhabi.
Yes, it's a team which matters. And thankfully, I have two other collaborators who complement my skill sets. One is Mesut Emre. He did his PhD from Cambridge. He's a health systems engineer. His area of interest is human-computer interaction. And Mohammad Yaqub, he himself built a commercial model for GE on fetal anatomy scan. And he has done his PhD from Oxford. And he leads the healthcare vertical in Mohammed bin Zayed Research Institute. So we are working with him.
Are there any other medical areas that the lab has started working on?
So I led one more project in the hospital on difficult IV access, which is if you go to the hospital, the first thing we do is put a cannula into your vein, or to draw blood, or to give antibiotics or painkillers, or do CT scan. And in patients who come in often, or patients who have chronic medical conditions, this is a challenge. And if you notice, one of the things most people complain about, or poor patient experiences, if a nurse takes 2 or 3 steps to get blood or gets IV cannula. So I led a project where in that process, we digitized the whole pathway. And now we've created institutional memory of who's those patients who have difficult IV access. Now that we understand that, we're trying to develop a predictive algorithm and also prompt the frontliners, maybe in the middle of the night, who comes in, oh, this patient has difficult IV access. So we can allocate the appropriate highly trained nurse to come and do that job activity. So that's one more project we're working on. But of course, what's happened in this collaboration is Mohammed and Emre are speaking to other colleagues in my hospital. And that has created more opportunities for other colleagues to collaborate. I know they're having independent conversations. So in those, of course, I'm not actively participating, but there are other collaborations they're doing. Yes.
So moving forward, this could grow into a lab that develops many different kinds of research.
As if you think about the biggest biohealth clusters, Stanford or Harvard or Cambridge, what is the most important of these biohealth clusters is people from diverse backgrounds work together to solve a problem. And historically, doctors, we live in our hospital. We have a small ecosystem. We just talk to each other, each other the same ideas, and come to roughly same conclusions. What is fortunate about with our UAE and Abu Dhabi specifically is we have these state-of-the-art universities which have come to us proximity in Khalifa University, New York University, Abu Dhabi, where some of my collaborators work. And there is ADIA, which has allowed me the opportunity to meet people. And when I explained to them the problem, my wife is an engineer. She has her own successful startup, not in healthcare, it's in fintech. She told me engineers solve problems, but they need to be told what problem to solve. And I'm very good at explaining my business. So these two engineer colleagues of mine, Emre and Yaqub, are helping me solve these problems.
Any other partnerships that are prospective or invited or in practice at the moment?
Of course, the whole idea is this has whetted my appetite, because if you think about doctors historically, we have assessed ourselves the number of patients I see and number of publications I do. But realistically speaking, at best in a day, I can see 30 patients, 30, 40 patients. And if I publish, I can publish maybe 40, 50 papers. But what I realize is if I could master the digital space, I can impact more people. And one of the things which I'm doing right now is evangelizing this way of working to my fellow colleagues. So I get invited to conferences where I talk to fellow physicians, is that whatever you're doing, think digital first. All your best practices, you know that you're doing high-end work. Why don't you create a digital process of your work? And this is what I've been focused on is whatever best practice I identify or develop, I make it digital first. Once I do that, this can be machine learned. This can be made into a solution, which can be monetized. We've not reached that stage, but it will allow you to do publications, because even though I'm part of many industrial consortia, because I have access to data set which doesn't exist outside Western world. Many of my colleagues who stayed back in the West working in much more prestigious universities are not able to publish as much as I am, because once I could create that digital infrastructure, it's helping me in my traditional way of success, which is publications, poster presentations, getting invited to peer review journals and conferences, but also I'm doing these other things as well. So this is what I evangelize. I was fortunate to be invited by the National Institute of Health, by Dr. Bukhani, to talk to fellow educators how to train the healthcare works for the future. So I'm presenting in the Global Health Exhibition next month in October in Riyadh, how to train the healthcare workforce of the future. So if you think about the way I was trained, which is a legacy way, I was trained to solve one complex problem, how to manage people on transplantation. And it took me 10 years of training to learn that. And I was only to solve one complex problem. But engineers, the way they train is they unlearn and learn new things to solve different problems. And because of the way I am trained, a specialization, I'm only trained one thing. This will make many people outdated very quickly, because when I joined healthcare, started practicing actually 22 years ago, PubMed, which is the repository of healthcare knowledge, used to double every 10 years. Now it's doubling every 90 days. There is no humanly way possible I can maintain my thought leadership if I just know what I knew 10 years ago. Hence, we will have to unlearn and learn new things. And in this 6 years of journey in UAE, I've learned so many new things, which I wouldn't have learned if I had not met all these people, if I was just meeting fellow nephrologists. So this ability to speak to folks across disciplines, then develop interdisciplinary collaborations, we need to speak to doctors, because doctors are autistic folks. We only know how to speak to each other, and which means that we're not able to solve problems, complex problems in healthcare settings. Someone recently described working with doctors is like herding tigers, because we're also individualistic. But if I have to work to solve complex problems, I have to work with people, medical technologists, pharmacists, nurses, AI engineers, data scientists, health informaticians. And this needs to be taught, how to work across disciplines. And I actually run a small lecture series. Once a month, I invite people across outside the hospital. I've had folks from Amazon come, Cerner come, a startup founder come, a venture capitalist come to talk to my residents. I learned not during my medical training how to solve these complex problems, but when I came here, I started meeting other people. So whoever I've learned from, I invite them to speak to my residents. But of course, this is not a ACGME or Royal College approved training way. But this is what I feel the healthcare physicians of the future need to be trained to understand this rapidly changing technology environment. How can I adopt this to improve patient care, improve patient outcomes, improve healthcare outcomes, and of course, maintain my thought leadership? I want my peers to say, Siddiq is number one. For that to happen, I have to understand this rapidly changing landscape. And part of my lecture series I organize, hopefully you can come to on that lecture series, is to tell people what this technology can do. Because no one teaches us the way the medical fraternity keeps itself by something called continuous medical education, CME activities. And the CME activities are to learn the known knowns, how to treat, say, I'm doing one this weekend, ACLS. But all these new things, AI or computer vision, machine learning, federated learning, I have to learn these concepts. Only then when I understand this concept, I can implement it in my practice.
And when you look at the UAE ecosystem and talk to colleagues in other healthcare institutions here, do you see that this is a trend that, is being adopted?
There's a real push from the real top of the country's leadership. What I can tell you, I meet people who are like me, fellow physicians, they're curious what I'm up to. And I tell them, I connect them to people I'm working with, I connect them to these resources we have, these beautiful resources we have in Visit AI, Khalifa University, University of Abu Dhabi. So I connect them, I meet them, I make it a point to attend all these technological conferences here, and I share those invites to my residents so they can come and attend. So when I started this, they were, oh, why is this guy? It's like a guy with a new tool, new hobby. But gradually, more people are seeing that this is the future. I see many of my fellow physicians reach out to me saying, you know what, I have this data set. Can you connect me to the Yahoo or Emre or other people? And I've been facilitating that. I think this is the future, and many people who have some knowledge left in him are adopting that.
Dr. Siddiq Anwar, thank you so much for joining us on Thursday Deep Dive today.
Thank you very much.
I've been talking to Dr. Siddiq Anwar, consultant physician and nephrologist at Sheikh Shakhbout Medical City, or SSMC, in Abu Dhabi. We're talking about the new RenAIssance AI Research Lab and the future of healthcare.
You've been listening to a recording of Middle East AI News Live for Thursday, August 22nd, 2024, by Carrington Malin. Thanks for listening.